We are the oldest society devoted to respiratory medicine worldwide.
You can see all of the work that's taking place for both global health and our international members in one place.
And no one of those groups of people can do it alone, and together there's an incredible strength.
Despite the name, the American Thoracic Society is an international organization. Membership is defined by a passion to improve lung health and reduce the burden of respiratory diseases that affect millions of people worldwide. ATS is the global organization that represents these professionals and what they do, reducing health disparities, improving patient care, helping the world to breathe. There is a key unifying force at the American Thoracic Society.
Collaboration is the key.
Nearly 16,000 members passionately engaged in improving worldwide lung health, and the ATS is harnessing that vast power to serve as an accelerator.
A hub, if you will, to try and coordinate these activities through science, through education, through research, and through advocacy. And not just in the US, but globally.
So it's really a global society operating in a North American location. So hailing from well over 100 countries.
And a worldwide effort is necessary to combat the burden of respiratory diseases.
Of the top 10 causes of death globally, respiratory diseases occupy 3 of those positions.
COPD is the third leading cause of death around the world. It affects over 200 million people.
And it is the only one that is increasing. Respiratory infections are the leading cause of death of children under the age of 6 in the lower and middle income countries.
Asthma affects well over 300 million people worldwide.
Nearly 4 billion people are exposed to atmospheric conditions, predominantly from air pollution, that are considered to be potentially damaging. These are striking figures.
To help call attention to these striking figures, the ATS collaborates with the Forum of International Respiratory Societies, or FIRS.
And FIRS is a strong and unwavering voice, continuing to drive home the point that this burden of disease can be lessened by improving the atmospheric pollution conditions.
The FIRS report aims to raise respiratory health to a top priority in global decision-making.
Communicating to the world's powers that respiratory health impacts the global economy in a massive way.
Asthma causes over $80 billion in cost to the healthcare system in the United States alone.
This is among the many impacts pointed out in the global impact of respiratory diseases.
It's always released around World Lung Day on September 25th. So yes, it is a big deal.
There's a call to action, an urgency to address long-standing health disparities.
You know, if all developed nations and major societies got together and work on this, there is a great opportunity to reduce and eventually eliminate health disparities.
It is an area in which the ATS intends to make a critical and lasting difference.
This is definitely something I'm very passionate about. The ATS, as a society, has taken major steps in helping eliminate disparities through increased health equity, diversity, and inclusion.
It's about positive, proactive change.
I think it permeates the fabric of the ATS.
For more than 25 years, the ATS has partnered to build research capacity in low and middle income countries through its MECOR program.
I think MECOR is another wonderful example of this sort of commitment to developing kind of capacity and researchers and people around the world.
MECOR is a multi-level research methods training course.
They started in Latin America, but now have expanded to all over the world. So they work in Africa, Indonesia, India, and Turkey.
So far, MECOR has produced more than 1,800 graduates from its global network of courses for health professionals who primarily work with pulmonary diseases.
Really developing an understanding of diseases in their environments, developing the capacity to address those diseases with people who really understand them locally, and then to develop those approaches. And so that's really, I think, at the heart of MECOR and very much at the heart of the ATS, which is understanding, how can we really serve our members best?
ATS is an incubator for new advancements and a leading source for clinical tools, guidelines, and best practices.
That is really the heart of the organization. And it is a global organization with a reach that is far bigger than the number of people who are actually present in it.
It's really an exciting time for I think, the ATS, and especially for global and international health.